Now, we have on standby Tonia Shodunke, a public health specialist, who would enlighten us more on this topic. Many thanks for joining us at this time. On Galaxy TV News.
Yes, glad to be here with you.
All right, so now into the discussion. What do you think could be done to address cases of NTDs in Nigeria?
Well, if we want to look at the situation of neglected um, tropical diseases, then definitely we cannot rule out the fact that sanitation is very important. We need to beef up our sanitation. Availability of clean drinking water in most of all these rural areas. Now, we cannot totally rule out the fact that the areas that are more affected are the areas where areas that are poverty stricken. So definitely they would need affordable drugs, would need to partner with international bodies and organizations, bring about unity in tackling these issues, because whether we like it or not, it is causing a serious harm to the society. Then, of course, we have to involve these people, and that's where education and sensitization comes in. I believe when the people, the rural community members, are more aware of the dangers of these diseases, they will be more open to, finding ways to better the situation. So a lot needs to be done. Of course, we can also look into research and availability of new vaccines, new treatments. A lot. There's just a lot that can be done in that angle, and I believe that the government has a large role to play in actually improving the situation.
So recently, the House of Representatives and the National Assembly, they declared emergency in the health sector because there have been some challenges in the sector. So do you think that the federal government has done enough in tackling tropical diseases?
Well, I believe the government has tried, but of course, there's always room for improvement. There's a lot that can still be done, and if I have to make an attempt to suggest other things that could be done in addition, number one, I would say that the government needs to develop and implement a national plan. Now, this thing is really becoming a menace, and therefore we need a plan, a solid plan on ground that will cover strategies that look into prevention, control, treatment, and of course monitoring. Because I believe if these four different areas are well tackled, there will be a very good grip on the situation. And of course, I think I would also suggest intersectoral involvement. Now, we cannot leave this all to the health sector. We need to involve other areas, other sectors such as sanitation, agriculture, waste management, and of course, environmental. We need to let them understand that this thing is a collective effect. It's really affecting the society, and so if we can all come together in an interdisciplinary format and then tackle this issue, it will go a long way. Then of course I would really suggest that more collaborations are put in place, collaboration with international bodies, collaboration that seeks to improve the sensitization of people so that there's more education, there's more discussion, open discussion within even other areas, other countries in Africa that are affected. Now, trust me, the more we open avenues for these discussions, the more we will actually attract more of global attention. And once we are able to effectively attract global attention, trust me, it will go a long way. Now, if I also need to pinpoint an area or an angle that seems neglected, then it will be the area of monitoring. Now, you cannot fully and effectively tackle tackle a situation you do not monitor effectively. Now, what are the numbers? How far have we been able to, combat the situation? What are
Yes,
the gaps
definitely.
if
And
we do
since
not
it is often
effectively monitor?
advised that people should not just leave the affairs of the country in the hands of the federal government, so what would you advise that residents and citizens
Exactly.
themselves, what steps would you advise they should take towards tackling entities in the environment?
Now, there has to be more involvement from the area and the angle of the people. They have to bear the burden also. It's not entirely going to be left in the hands of the government. The government cannot do everything. And so we also need to take responsibility. And if we have to do that, then we need to do more of sensitization, educating the people to understand the extent to which this is harmful, the fact that it's going to affect the next generation. And then, of course, if we can break down implementable, steps that they can take towards tackling the situation, of course, when we talk about maintaining good sanitation, being more conscious of little approaches such as hand washing, such as, being conscious of their health, talking to the next generation, the children, the mothers, the parents, really sensitizing the children also about this. And of course, maintaining good clothing systems where necessary, and where government provides facilities such as like treated nets. These nets have to be used. They must be used. So we need to sensitize these people about how important it is. So they will also be involved personally. We need to be involved personally so that hand in hand we can work with the government to really tackle this thing and ensure that it gives a lasting solution.
All right, we thank you so much for sharing with us your thoughts on this subject.
Thank you so glad to be on.
And that's Tonia Shodunke, a public health specialist.